today's seminar on vaccine acceptance in Harlem, COVID-19 vaccine acceptance in Harlem, is co-hosted by the CUNY Graduate School of Public Health and Health Policy and by the Honorable Gail Brewer, the President of the Borough of Manhattan. Gail is actually with us, but she has some computer problems and you won't be able to see her or listen to her at this moment. We hope that this can be fixed as the seminar proceeds. We will be recording this seminar in order for others to be able to listen to the presentations today, and it gives me great honor to welcome the Honorable Gail Brewer. But alongside Gail, I will, with your permission, put the slides on the screen for the presentation today. And along with our esteemed guest, we have with us my dear colleague, Dr. Scott Ratson, a distinguished lecturer at the CUNY School of Public Health and the executive director of the national and global initiative Project Convince, and as well as our champion, Deborah Levine, who is the director of the Harlem Health Initiative, and my dear esteemed Lauren Rao, who is the program manager for Convince USA. This is a very important role for the Public School of Public Health for New York City. We have been conducting polls to glean a better understanding of perceptions, opinions, but also the impact of the COVID pandemic on all New Yorkers. And we started last March. So far, we have conducted about 16 surveys, each of which either only included 1,000 representatives from New York City, but also occasionally included 1,000 representatives, respondents from the state. From time to time, we conduct special surveys in our neighborhood in Harlem, and the topic we will cover today is the result of the most recent survey conducted mid-February with 1,000 respondents from a representative sample. We always conduct our survey in English and in Spanish. We use cell phones, SMS texts, and as you see, almost half respondents use that technology and half of the respondents responded through landlines. And we make sure that we make adjustments so that the results, as you will see them today, are representative of the age distribution, the gender distribution, the ethnic and race distribution, as well as the distribution of level of education in our neighborhood based on the 2019 American Community Survey model. So we feel rather secure that the results we'll share with you today are actually representative of Harlemites. If I could look at the next slide, one of the most important things that we were concerned about within Harlem was the fact that we were beginning to see, sometimes in major newspapers like New York Times, reports on differences between neighborhoods in the level of vaccine coverage. And so this lends itself sometimes to misinterpretation. So for example, if you say that people in Harlem have been immunized less than people in the Upper West Side of Manhattan, people then immediately make deductions that are not accurate, thinking that, well, perhaps people living in Harlem are more resistant to receiving the vaccine than people in the Upper West Side. And that actually is not fair. And so we thought we would approach the population that is eligible for the vaccine at the present moment, thinking we had one of two choices, either to look for eligibility by age. And as you know, at that moment, 65 and above were eligible to receive the vaccine. We could have, for example, chosen healthcare workers, but we weren't sure that the distribution within healthcare workers was equitable across race and ethnicity, and so differences uh, in that distribution could impact the results. And I want to reassure you here that if we look at rates of vaccination in that eligible population, you see that they are very similar across the various ethnic and racial groups, which tells you that in Harlem, with the level of access available, that African Americans, Caucasians, Latino, Latina, or Hispanics, and Asians receive the vaccine more or less at the same rates. And as you see, it ranges from 24 to 29%, which is well within the range of error. This is an important finding because in of itself, it says that the vaccine acceptance within that eligible group is not significantly different. But more importantly than acceptance, taking action and actually going and receiving the vaccine amongst these ethnic and racial groups was somewhat similar. Next, if you don't mind. On the other hand, even within Harlem itself, we see that there are some differences. So if we look at the zip codes for East Harlem versus the zip codes for Central Harlem, you see that in Central Harlem, 28% of respondents who are 65 years and older had received the vaccine, while only 19% of respondents of the same age group in East Harlem had received the vaccine. So you think in your mind, what does that mean? And in my mind, since we are not seeing differences based on race and ethnicity, it does bring to one's mind the possibility that access may play a role here. Facility of making an appointment or access to a place where one can receive the vaccine may be different in these two parts of the same neighborhood. These are all things that we need to look into in greater detail. And the purpose of a survey such as this is only to highlight certain trends that can be looked at in greater detail. I will turn the rest of the presentation over after the next slide, if you don't mind, to my dear colleague Scott Ratson. But as you see, when we looked at the question of vaccine acceptance, we saw a very serious improvement, very significant improvement in the number of people that they agreed or strongly agreed that they were willing to get the vaccine once it was made available to them. This is very different from results that we had in the past from all New Yorkers. And if you look at the entire respondents of 1,000, 80% of them said that they would receive the vaccine if it were made available to them. When we looked, when we classified them, again, based on race and ethnicity, you see that there are some differences, but there is no question that there is a surge in the acceptance rate of at least 20, if not 25% across all groups. So we used to ask that question, but it was speculative. There was no vaccine to be had. And so people were speaking about their perception in the absence of the vaccine. Now that the vaccine is actually there, you see that 77 or 78% of African American and Latina respondents, as well as 91 to 93% of white and Asian respondents, are accepting of the vaccine and wanting to take it. That is very reassuring. And when you compare that to some of the statistics where you simply plot rates of vaccination on a map without regard to people's opinion, you may reach the wrong conclusions. And it is very important for us to continue to monitor perceptions, opinions, and responses directly from the populations that are impacted by a health intervention as important as this rollout of the COVID 19 vaccine. I will give the floor to Scott, and then I will get back to you with some comments, and hopefully we will open the floor for your questions. Scott?
Thank you very much, and it's a great honor, and I thank the Dean for the introduction and the oversight. It is an honor to be on the faculty of the School of Public Health at CUNY and advance the ideas not only with the survey, but as I was introduced earlier with CONVINCE. CONVINCE is an acronym which stands for COVID, New Vaccine Information, Communication, and Engagement. And that's what we've been about, of trying to figure out ways of communicating, but also understanding the publics of all levels so we could most apt help get us out of this pandemic. And let me also just thank Honorable Gail Brewer and Deborah Levine for convening this. It's been indeed an honor to be working with Deborah and Lauren Rao on our team as we've been developing now 16 different surveys since the beginning of this epidemic in New York, which really was only 1 year ago. We've come a long way, and the Dean identified this slide of the 4 out of 5 respondents in Harlem willing to take a vaccine as an important development. I think this is a front and center piece that people want to get the vaccine. Now, what we set out to figure out is how and why they are able to get the vaccine, and what the survey could show us to inform not only campaign but implementation of vaccination across the city, and particularly in this case in Harlem. So the next slide, please. We have tried to figure out vaccine acceptance, vaccine confidence, and there are a lot of different rubrics, but eventually what people have landed on is individual self-efficacy, that I want to take the vaccine to protect myself. And this was the major reason in Harlem that people have been motivated. And this is consonant with surveys across the US and world, particularly amongst older populations. And at this point in the vaccination campaign, of course, is our 65 plus population. Others are thinking more societal. I want to help end the pandemic, the 29%, to protect my friends and family at 26%, and then my community, again, more of a solidarity issue. This is a reason that's been motivating right now, but as you'll see, we're trying to understand with both quantitative and qualitative approaches. As much could be done from a 1,000-person survey to see how respondents feel at this case, in this case, in the middle of the month in February. The next slide, please. But why do they want to wait and see? And that's been the problem that Kaiser Family Foundation surveys have been reported in the press, Gallup and others. But this is really specific to Harlem, which is really the first snapshot, that people want to wait and see how it works. And they don't want to be first in line. We believe in deeper understanding. This goes back to the idea of people being guinea pigs, or experiments that have been done in the past, and the Tuskegee experiments continue to come up in Black communities throughout the United States. But wait and see how it works is still number one, but very close, is really statistically insignificant, if I could say that, to close to some of the others. That some people want others to have high risk first and then wait and see until it's easier for me to get. But of those that prefer to wait, people are still pointing to wanting to get information from a trusted source. And you'll later see we talk about who is a trusted source and where they can get that information. But still, and this again, if you multiply the numbers and see where this is against the general population, 22% of people are who we call vaccine deniers, vaccine skeptics, a recalcitrant population. And that's a concern, because it's going to be very difficult to move to that. And from a scientific and public health standpoint, we need to get 80% coverage, which means over 80% of the population vaccinated. And right now, we only have vaccines that are available for the 16 plus population. So we have a lot to be concerned about. We do not want that 22% to grow, and we also do not want it to strengthen and resolve. The next slide, please. So we ask them open-ended questions, and we've been doing this since March of last year. These are one from the most recent survey. Some people don't feel they need it or they don't trust it. And others, still might say, I have immune issues and want to see how it works. And we haven't probed exactly the immune issues. We know the reality, allergic issues are very rare, but there are people that still answer that way. And then I would feel more ready to accept it if I had one, more clarity on the allergic conditions and piece I just mentioned, more assurances from people who've already received it. And in many cases, they say, I want to see after 2 doses, and more research, which is an answer that is across the whole spectrum. The next slide, please. We ask people, what do they think about the distribution? Is it fair? Is it equitable? But one thing that we've been tracking also is the optimism in the population, which we've been doing in our other surveys since the election. And the positive thing that we could say is that we continue to see improvement. And in Harlem, 3 out of 4, or 76% of people, think that efforts to distribute the vaccine will improve under the Biden administration. Clearly, the vaccine rollout was during the lame duck and the Trump administration, but improvement is certainly there. And in the case of Harlemites, we have found that people are in line with the priorities that have been established of priority populations. 1, frontline healthcare workers first. Anyone who wants it was really moved up quite a bit here. People over 65, essential workers, and then communities that have been hardest hit. This may be different in other equity areas, but again, this is a point in time in this phase of the pandemic when the vaccines are just rolling out and there are not enough vaccines, as we know, which is part of the problem that we're still trying to address as a public health community, as well as everybody throughout all levels of government. The next slide shows why we think people are having problems. And this is daily news. I don't think we have to go too far. And we probably already all know someone, at least a family friend or someone in our workplace that is having difficulty making appointments. And this is as simple as, do you have internet access to technology, and not only literacy in using it, but also literacy in the whole process here. So 3 out of 10 people reported having trouble making an appointment. 2 out of 5, an older population, is even more disparities that are there. And some of this is just knowledge. I don't know where to sign up. I don't know where to get a vaccine. And we could have asked others that even if you did know where and you did sign up, it was you're basically like trying to win the vaccine lottery in some cases of how difficult it has been. The next slide. And this is very important, and this is further broken down also by Black population, Latino, Latina, and white populations. But it's very important to look at where Harlemites would like to get the vaccine. That there's some assumptions that we could have mega sites, whether it be sports stadiums, or even in schools in certain areas. But yet more people prefer a doctor's office or hospital. Over half just overall of Harlem residents. But if you look at this, if you separated this to a Black population, almost 2/3 would rather go to a doctor's office or hospital to get their vaccine. Where a Latino population, they also would rather get their vaccine in the pharmacy. So they're closer, although the hospital and physicians' offices are close behind. So the point here is if you see the top 3, those are places that people often call their healthcare home, or a place where they're accustomed to going for healthcare, and it's very difficult to move that preference, and something that we need to consider. And I know the dean has some comments also on this slide, because we think this is one of our important findings from the survey. Dean, you're on mute.
The objective from these surveys also is to perhaps inform, if not influence, policies. And I have half a mind to encourage our city or the state or the governor to make available sites for immunization, including sports arenas or mobile units or local schools or even places of worship. But it's also important for us to realize, because of the nature of that particular vaccine, it's a new technology. Um, People have heard that maybe some people will get reactions to it. They are not that comfortable, it seems. And that, that was not, that is one of the ways in which a survey like this is useful. It does seem very clear that our respondents are more comfortable getting this vaccine in a health prepared facility, or uh, uh, you know, uh, at least an environment where they feel uh, safe from a health perspective. So they may feel like uh, in a, I don't know, basketball court in a school or something of that nature, that they may not be as protected as a hospital with a readiness for an emergency, for example. This is something that we need to think about, and either we extend hours in some of these healthcare facilities, provide them with more personnel, either doctors and nurses. But on the other hand, there are some practical difficulties here, because most doctor offices do not have freezers below 70. It's not how many of the private offices are set up. And that's something that I think an important finding. I'd like for us to just stop and think about this. And I'm very heartened that the Honorable Gail Brewer is with us now amongst the on the screen. And so as we complete the presentation of the slides, she of course will have her turn to bring her perspective to the audience. But that, I thought I'd just stop there for a minute just to discuss that slide and see what it could have in terms of implications on perhaps policies and programs.
Mhm.
Back to you.
Thank you. And I will present three more slides and then turn it over to the Honorable Gail Brewer and all of you for time for discussion and question and answers. And really appreciate the Dean again highlighting the importance of this slide and what we are finding to question assumptions. And that's what our survey does, is it question assumptions and then really see how the population responds in a valid and appropriate reported way. So we thank you for joining today to hear this. The next slide really gets at where people seek information. And from the very beginning, the hypothesis was that people are getting their information from social media. That's where they get their information. But in reality, that's not the case. Most people in Harlem, and we found across the city, are still tuning in to news sources, and that's television news first, and oftentimes it's cable news on television. So it's still very important to think of where people are getting their information. That's not saying that social media is not influencing the other news sources, but clearly the television and mass media are still very important and components when we target any of our campaigns or communication efforts. The next slide demonstrates still where people are seeking information on vaccines in general. And this is more, shall we say, of the scientific piece. The federal government through the CDC still continues to test highest. This has continued to be the case, even as we looked at this during the last administration. But as you can see, it's first the CDC, the state resources, the federal administration, which that would include Dr. Fauci and others there, and then the city officials. World Health Organization is also listed and comes up in the survey. And then finally, feelings of trust. And as I mentioned, our Commonwealth Fund work with Convince is looking very deeply at trust and how people trust health services. And we're trying to understand this, as I say at the outset, through, again, thanking the Dean for the honor of teaching in the School of Public Health, where we have a health communication for social change program. And in the communication areas, trust is the fundamental element that we strive for. So we try to measure this in each of our surveys, and it's very difficult to really tease out all the important areas. But having said that, we did this here. We found that 4 out of 5 people in our survey agreed that all people can trust that COVID vaccines are safe for them. And that's really the most important piece, that safety is even more important than efficacy or effectiveness of these vaccines. And the fact that we have this high level does give us hope that the vaccine will get to the level that of 80% that our respondents have said in Harlem that they're very interested in getting and taking the vaccine. And as you can see, 3/4 also, trust that the vaccine will be available to everyone. So the equity issue is strong. It's not consistent across all groups, but the fact that we have both government sources, both in the city, the state, federal government speaking to equity more, perhaps is diffusing. And we're happy to see, if I can say as a researcher, I personally am. I think this is positive. Although it's still a cause for concern if all of a sudden we do start to see disparities emerge. So we will be monitoring this as we have in our citywide surveys and others as well. But the trust area, and I know the dean will have more to say on this as well as others, is fundamental to our aspect of public health progress and in getting building back better or building back New York City and Harlem specifically. So again, I want to thank you for the honor to be able to present to all of you and to engage as a faculty member here at CUNY School of Public Health. Back to the Dean and the Honorable Gail Brewer at this juncture. I'm mute. Sorry.
There you are. The purpose behind a survey like this is to start a conversation. And we begin to gain insights into things that deserve more questioning and more in-depth surveillance, so that we are able to collaborate with communities in reaching health goals that they desire for themselves. In that particular instance, I had a question whether we had previously surveyed the community on vaccine acceptance. And yes, as we said earlier, we had 16 surveys so far. And earlier on in the summer, the vaccine acceptance was as low as 53% amongst African American respondents, and in the mid to high 60s amongst Caucasian respondents. And today, we're seeing a very different response.